Today's webinar is being presented by Dr. Dane Mosher. Dr. Mosher is a board-certified family physician. Like many people in the field, he began studying the treatment of autism after his son was diagnosed with the illness. Dr. Mosher was raised near Houston and has spent most of his life in Texas. He received his Bachelor of Science degree in mathematics from New Mexico State University, followed by several years working as a computer programmer in Austin and West Texas. In 1999, he changed careers, becoming the head brewer for an Austin area microbrewery.
Welcome to GoToWebinar, Web Events Made Easy
of North Texas Health Science Center of Fort Worth. Here he completed a 3-year family medicine residency at East Tennessee State University in Kingsport, Tennessee, a primary care training program in an area of the country that sees a wide variety of pathologies. The teaching hospital in Kingsport has one of the busiest emergency rooms in Tennessee. His training there included pediatric outpatient and inpatient care, as well as time in the pediatric ICU. Dr. Mosher's professional interests include osteopathic manipulative medicine, functional medicine, which focuses on the diagnosis and treatment of the root causes of chronic disease, and urgent care medicine. Before we begin the presentation, please note that questions can be typed into your control panel throughout the presentation, and time permitting, they will be addressed at the end. Now please welcome Dr. Mosher.
Good afternoon. I'm Dane Mosher. Thank you for that introduction, Nisi. Today I'll be talking about considerations for parents of children with autism spectrum disorders. And I should have plenty of time at the end of this webinar to take questions, and so feel free to send those in during the talk, and I will address them afterwards. Just be aware that I'm not able to provide specific medical advice. All right. So why do we care about the health of our siblings, of our kids with autism? Is they don't have autism, or we wouldn't be talking about them. They'd be autistic. And so why do we need to talk about their health? Well, there's several reasons. I think one good reason is that our autistic children tend to be squeaky wheels. And even though we're not consciously ignoring our other children, certainly, our autistic children do tend to demand our attention day to day. And so even though without even thinking about it, their siblings might get overlooked. There's also the idea that I think is faulty, and that is that autism is you either have it or you don't. And I think it's good to remember the term autism spectrum, because it's a large spectrum, and there's a certain criteria at which you're formally diagnosed with it, but that doesn't mean that if you are not diagnosed with it per the formal criteria that you don't have some aspects of autism. And I'll talk about how that might apply to our families. And then also it's not unusual for families to have health problems that are unrelated to autism, and those health issues need to be addressed, of course. So what is autism? Well, there's the formal diagnostic criteria, which is based on behaviors. Specifically, it's restricted interests, impairment in social interaction, impairments in communication. But that does not explain what's actually going on. It's because I believe those behaviors are just the tip of the iceberg, so to speak. Typically we see multi-system illnesses in these kids involving the gastrointestinal tract, the immune system, and multiple metabolic issues in these kids. And there's plenty of evidence to back that up. So what do we know about issues with siblings of children with autism? There's not a lot of research done on this particular issue, but there are a couple of good studies that I think point out that there are issues. First of all, there's this study by Constantino which shows that in our siblings of kids on the spectrum who do not have a diagnosis of their own, they do have a much higher rate of various developmental delays, especially speech delays, and some autistic-like behaviors, although not qualifying for full diagnosis. And the actual percentage they found was about 20% of the non-diagnosed siblings had these issues, and about half of those, or about 10% of the total, exhibited autistic qualities of speech. So even though they don't qualify for diagnosis, there's certainly good reason to try to do some early intervention to try to correct those issues. I should also point out that these issues are going to be a lot more common in your male children than your female. The female sex does seem to have a protective effect. As I'm sure most people know, there's about a 4-to-1 ratio of male to female affected children on the spectrum. So why might this be? Why would siblings have these semi-autistic traits? Well, number one is their genetics. They're certainly genetically related, being siblings. That doesn't necessarily mean that they're going to get autism. Even identical twins don't always share the diagnosis, but they do most of the time, certainly. So they have the same genetics, which might put them at risk for certain metabolic issues, certain detoxification errors in their metabolism. They share the same environment, typically, living in the same house. They may be both exposed to the same toxins, perhaps lead paint, contaminated water, poor diet, polluted air, and then, of course, the common diet. Usually, siblings do eat similar foods, not always. All right, so let's talk more about the specific issues in the home environment. Well, diet is, I think, very important. The standard American diet, also known as the SAD diet, and abbreviated, truly is sad. It's typically filled with multiple deficiencies. The most common ones that come to my mind are magnesium. Also, the American diet tends to be low in potassium. There may be several vitamin deficiencies depending on the quality of the food, certainly. If a child's eating a lot of fresh vegetables, some fruits, organic meats and such, they're less likely to have that issue. But if they do have deficiencies, it's going to put them at risk because their body's not going to be working at its peak efficiency. Let's talk about exposures in the home. I think the most common exposures thought to be related to the etiology of autism are pesticides, herbicides, toxic metals, especially lead, but also mercury and aluminum. And then pollution such as exposure to diesel exhaust. There can be lead in the soil. There may be a house that's in the flight path of an airport. And jet fuel is still contains lead. Lead is yet to be removed from jet fuel, although it will be shortly. Potentially harmful medications. This is something that siblings would be exposed to based on the style of the parents. For example, Tylenol or acetaminophen is commonly given to kids when they're sick as a fever reducer, as a pain reliever. Also often given in conjunction with vaccines to reduce the discomfort of vaccines. I'm listing it here under potentially harmful medications, and this is somewhat of I think a new way to think about this. Acetaminophen clearly depletes the body of glutathione. In fact, N-acetylcysteine, which is a therapy to increase the body's production of glutathione, is the antidote for a Tylenol overdose. And the thinking is that taking acetaminophen in a child who is innately low in glutathione could deplete it to a critical point, and it could be that low glutathione combined with other stresses, such as the stresses of a vaccine or the stresses of a viral infection, could put that child over the tipping point and result in a toxic insult to the brain. I also wanted to talk about the use of unnecessary antibiotics, because I think this is a problem that gets talked about occasionally. I don't talk about it much in my practice, but it's something I certainly witnessed a lot in all of my training and during my urgent care work, and that is that a lot of parents bring their children in to see a doctor for basically the common cold or something similar. And although things are definitely getting better, and a lot of parents are sometimes relieved to hear that, when the doctor says, I think it's a viral infection. A lot of parents are happy to hear that, and they take their kid home and they do basically comfort care while they get over the viral infection. There are definitely some parents that I've met who are not comfortable with that plan, that want a prescription for an antibiotic even though it's really not indicated. And there's some real harm in using an antibiotic in that way. Antibiotics do have a negative effect on the intestinal flora. They kill off a lot of bad bacteria. And this is not a reversible thing. These bacteria tend to decrease in counts, and they don't fully bounce back after you get off the antibiotic, even with probiotics. Probiotics can protect someone while they're on antibiotics, to protect them from developing antibiotic-associated diarrhea, perhaps helping prevent them from a superinfection with C. difficile. But they do not negate the harmful effects of an antibiotic completely. So I would just urge all parents to try to minimize the use of antibiotics. For upper respiratory infections like the common cold and the flu, they're really not generally needed. Even if it is a bacterial issue, such as strep throat or mycoplasma, H. influenza, strep pneumonia, if they're confined to the upper respiratory tract, typically the body can overcome that in about the same amount of time as it would overcome a viral infection. Now, certainly if you see evidence of a pneumonia, lower respiratory infection, or a potentially invasive infection, you have to use the antibiotics. But really, I think, perhaps I'm belaboring the point, but I think this is an important thing to be aware of. Let me move on to genetics. We talked about this already to some extent. Siblings do share genetics. I think there is clearly a genetic link with autism spectrum disorders. I don't believe it's the sole etiology. I think, and I'm not alone in thinking this, that there's most likely a genetic predisposition, and then combined with a toxic insult at an opportune time that leads to the development of autism spectrum. Let's talk about the siblings' emotional health. I'm not going to talk at length about this because Dr. Claire Schutte just presented a webinar a little over a week ago on this subject, and actually earlier in the month, and then Gina Martinez presented part 2 of that webinar. And this is the YouTube link. You can always go to the YouTube channel of the Johnson Center to look at these old webinars. And we also maintain a blog on our website, particularly with a spotlight on sibling issues, and there's the website for you. So what should you do for your young sibling of a child who already has autism? Well, first of all, you need to be aware of the fact that these developmental delays are possible, and it's not a small minority that gets them. So look for them. I would say be extremely vigilant for looking for them. Go online and look for developmental milestones. You don't have to memorize them. You can just look them up and just make sure your child is roughly on track. Listen to the other caregivers of that child if they express concerns. This might be grandmother, it might be a daycare worker, a babysitter. Speech therapists commonly will be on the lookout for these things. And don't ignore if someone says that they think there's a problem, even if you're sure they're not. You can talk to the child's pediatrician about any concerns you have. I would point out that pediatricians aren't always as aggressive on initiating therapy, or at least diagnostics for developmental delays as I would sometimes like. So if your child's primary care provider listens to your concerns and says, well, why don't we wait and see, let's give it 3 months or 6 months, I would be hesitant to be okay with that advice. I would go ahead and see if they'd be willing to refer you to a speech therapist or other diagnostician to check for a developmental delay. And if they are adamant about doing so, you always have it within your right to take your child to see one of these people on your own. If a delay is identified, the earlier you can intervene, the more likely you can reverse it. So I wouldn't put things on hold for a year if you can avoid that. And here's a link to one of our blog entries on this subject. Well, there's another research paper from 2011. This is from the Journal of Pediatrics, looking for the risk of having a child with autism if you've already had a child diagnosed with it. And they concluded that the risk was much higher than previously believed, and it's about 19% per child. Now that's an average, and so your boys are going to have a higher percentage than that, and your girls are going to have a lower percentage than that. There is a new field of treatment focused on trying to prevent this from happening to begin with, and ideally this kind of treatment would begin before conception. And Kelly Barnhill, our clinical director and a clinical nutritionist, is going to be presenting a series of webinars on prenatal care and prevention, and that will be ongoing through the summer and the fall. I highly recommend that you look into this if you have any interest in having other children. I'm going to talk about diet. This is something that a lot of you who have kids on the spectrum who are at all looking into biomedical treatments probably have heard ad nauseum. So I'm not going to hopefully spend too much time on this issue, but I do think this is an important issue, and I don't think it really should be restricted just to children with autism. The foods that doctors like I and nutritionists who work with kids on the spectrum identify as problem foods are not just problems for kids on the spectrum. They may be more of a problem for those kids, but the there's a lot of health problems associated with certain foods in the general population, and so I'm going to talk about that because I think that specifically applies to our siblings. First of all, a healthy diet should be based on fresh foods, and so when you go into the grocery store, you should shop around the perimeter of the store, not in the middle of the aisles. So you need to go to the produce section, you need to look at eggs, you need to look at the meat, and those are all on the edges of the store typically. Then inside you see canned foods, processed foods, foods wrapped in plastic bags. Those are the things you really want to minimize. I'm not saying that everyone has to eliminate those from their diet 100%, but the less you eat of those things, generally the better health you're going to have. And so grocery stores, especially ones that carry organic produce, are a great resource. I think that farmers markets are also an excellent resource. And I listed a website there, localharvest.org, that helps you find farmers markets in your area. Farmers markets typically are markets where you can buy produce that, although may not be certified organic, is often grown with organic practices. Getting the USDA certification of organic is sometimes too expensive and difficult of a task for the small farmer. But you can ask them specifically about their growing practices. And at the farmers markets, you'll commonly find out they're not spraying chemical pesticides. They're using natural methods to control pests. They're making sure the soil is very healthy to maximize the nutrition of the produce. And you'll typically find really good prices on this stuff, often better than the grocery store. So I'd really make use of that resource. Our dietitian, Alan Gutierrez, recently did a webinar called Eating Well for Immune Health. It is chock full of great information. Alan is a wonderful resource for dietary advice. I would highly recommend you go to our YouTube page and watch that if you haven't already. So general eating guidelines, besides whole foods, shopping perimeter, you want to eat organic. And that's for two reasons. One is to avoid chemical pesticides, which are really more harmful to health than I think is typically publicized. And the other reason to eat organic is to avoid genetically modified organisms. There's a lot of debate on that issue as to whether these things are harmful to our health or not. I think that there is some evidence to suggest that they can be harmful, but I think the lack of research in this area is also telling, and I think it warrants caution with eating these foods. One of the concerns I have with GMO foods is that genes are inserted into these plants to either produce some sort of pesticide at a low level, or to be resistant to certain herbicides. And what that means is that the genetically modified crops tend to be sprayed heavier than regular crops. They typically are going to have more residues of herbicides and possibly pesticides on them because they can endure it. The other thing that concerns me is that there is some suggestion from research with mice that these genes that code for the pesticides and herbicides can be transferred from the foods to intestinal bacteria. And although this hasn't been proven to have happened in humans yet, I can't imagine a more horrible thing than to think that the bacteria that you've developed a relationship with since your infancy and that permanently colonize your intestines are now producing low levels of pesticides throughout your life. I think that would be a horrendous thing. So I would urge caution with any genetically modified foods. If you're going to eat meat or eggs, I would highly recommend getting hormone-free versions of the animals who are ruminants. I would recommend getting grass-fed products from them. Grass-fed beef and lamb and bison are going to be much higher in omega-3 fatty acids, much lower in inflammatory omega-6 fatty acids. and much richer in vitamins such as vitamin A. You really get a lot of nutrition out of that grass. When you eat animals, you want to eat healthy animals who are happy, and I don't think that applies to animals sitting in a feedlot for much of their lives. Gluten-free. This is an issue with some residual controversy. I do think there's plenty of evidence to suggest that gluten is a harmful food for a lot of people, not just kids on the spectrum. The most severe gluten issue, of course, is celiac disease, and celiac disease is associated with a number of different autoimmune diseases. Autoimmune thyroiditis, psoriasis, dermatitis, herpetiformis all come to mind. A lot of people with autoimmune diseases who have nothing to do with an autism diagnosis do pretty well getting off of gluten. So some people say that gluten is not good for a single person on the earth. I'm not going to go that far. I guess I don't know that. That's possible. But I would not look at gluten as a necessary food, certainly. And so I think that there's many great reasons to get off of gluten. Another reason to get off of gluten, if you've got a child at home with autism on a gluten-free diet, just it's so much easier to maintain that if the whole family is gluten-free. I know in my own experience that sometimes we'll have house guests who bring their own gluten, like a BYOG at my house because we don't have it. And I think in every single case that's happened, my son, who is on a gluten-free diet, manages to get into it. And it could be a loaf of bread, it could be a McDonald's chicken McNugget. It doesn't matter. Somehow he manages to get into it. And so keeping it out of the house is really the best policy for me, and I think for a lot of people. The casein-free diet is commonly recommended, at least as a trial for kids on the spectrum. I think that there are many good reasons to consider that even for people who don't have autism spectrum disorders. If you have any history of allergies, I'm talking primarily here about pollen and other environmental allergies, or eczema, if you have a history of frequent ear infections, or a family history of type 1 diabetes. Dairy products typically make all those things worse. And although there are some people who can tolerate it just fine, I think that overall is a minority of people. So certainly with those issues, I would consider eliminating it on a trial basis. And then I think if you've got a child on the spectrum who's on a casein-free diet, same thing applies here. If it's not in the house, it's going to be a lot easier to maintain that diet. Okay, this is a list from the Environmental Working Group. They have a great website that I would recommend everyone check out at some point. And this is their list of this just came out actually, the list of their clean 15 foods and their dirty dozen plus, which is actually now 14 or 15 foods. And so these are the things, the clean 15 are the things that you can probably safely buy non-organic and not worry about pesticide residues. And then with the dirty dozen plus being the most heavily sprayed crops that you should really make an effort to eat organic. And it's kind of a difficult thing to do when you first decide to do this, but I made the decision long ago that I wasn't going to eat a lot of these dirty dozen unless they were organic. And once I made that decision and knew which foods to look out for, actually it was pretty easy. Most of these foods are readily available organic at most grocery stores. Let's talk more issues with the diet. Seafood, although not everyone eats this, and I don't think everyone needs to eat it, but if you do choose to eat seafood, be sure to get low mercury varieties. And if you're interested in wondering which ones are low mercury, the FDA has a very good list looking at. It's a compilation of statistics over several years, looking at mercury contents of various seafoods. So you just go to fda.gov and you can do a search there. Avoid high fructose corn syrup. There's many reasons to avoid high fructose corn syrup. First of all, fructose is really a bad sugar. The body doesn't metabolize it very easily. Too much tends to over time lead to fatty liver, metabolic syndrome, and then ultimately diabetes if it goes on too long. Another thing with high fructose corn syrup is that there may be some residue of mercury in some of the batches that are out there. So, and you know what I found is long ago I decided I'm not going to eat this stuff anymore, and boy, that really eliminates a lot of really bad food from your diet. If you just kind of make a policy of avoiding it at all times, it kind of gives you a lot more willpower, because you just look at that label and you say, I'm not eating that, that's poison. And then suddenly your diet just got a lot better. Canned foods are a problem, and a lot of people may not know this, but canned foods are commonly lined with BPA, or bisphenol A. And bisphenol A is an ingredient in some plastics that acts as an endocrine disruptor, and it's suspected to be linked to insulin resistance and obesity and early puberty. And the government has been slowly coming around to the idea that maybe this isn't such a great thing, and it's now mandatory that infant baby bottles and such no longer contain this. I would just try to eliminate it if at all possible from your diet. And I think that canned foods are still the biggest source of it out there. Not all canned foods contain high levels of it. Typically, canned fruits tend to be safer. Canned tomato sauce tends to be worse. I talk about minimizing artificial colors, MSG, and other excitotoxins. An excitotoxin is a chemical that acts as a neurotransmitter in the brain, similar to glutamate. And glutamate is an essential neurotransmitter. It's very important. It's not something that can be eliminated completely, nor would we want to eliminate it completely. But excessive amounts stimulate brain cells potentially to the point of killing them. And it's also linked to the development of Alzheimer's disease, possibly other neurodegenerative diseases. So artificial colors do often have a excitotoxic effect. Monosodium glutamate certainly does. Other excitotoxins would be the next line there under artificial sweeteners, NutraSweet or aspartame, also excitotoxic. I would avoid it if at all possible. I don't think any artificial sweetener is necessarily a good thing. I think that it probably, at the very least, is tricking your body into producing insulin, because I think the taste buds are telling the brain, here comes some sugar, and so your body makes insulin, but it's not getting the sugar, so it drives your blood sugar down low, and that makes you more hungry, and then you eat more. And there's certainly evidence that artificial sweeteners have no link whatsoever to weight loss. So I would avoid them. I think if you had to choose among them, saccharin has probably got the safest record that I know of, but I still wouldn't choose that over something like raw honey or stevia. And then do not heat food or store hot food in plastic. That is mainly to avoid leaching of plasticizers known as phthalates or bisphenol A that might be in the plastic from coming out into your food, because those things tend to leach out in the presence of heat, in the presence of sunlight, and with the age of the plastic. One thing that I think is just horrendous is when I drive by a convenience store and I see cases upon cases of bottled water sitting outside the front door along the windows, just getting baked in the sun. And boy, I really fear for the people who end up drinking that water because they probably have no idea what's in it. Cleaning up the home environment. Well, there's a lot that we can do here. I think washing hands is very important, and I'll go into that in a little bit here. But let's not use antibacterial soaps. There's really not a good reason for using them. Regular soap and water remove just as much bacteria as an antibacterial soap does. In antibacterial soaps, I mean, a common antibiotic found in these is triclosan. Triclosan is associated with the development of antibiotic resistance in the bacteria that are already in your body or on your body. It's also really bad for fish because it tends to go down the drain and it doesn't break down in our water treatment plants, so it tends to go out into the rivers and other bodies of water, and it's having a detrimental effect on fish. So I really would avoid those if possible. Getting back to washing hands. Washing hands is important not just to prevent the transmission of infectious disease, which is a wonderful thing that washing hands does, but it's also good for just rinsing off the toxins that our kids get into. There's a lot more out there your kids are touching than you realize. For example, a thermal receipt from a grocery store, a restaurant, or a gas station often will contain bisphenol A on that receipt and can come off on the hands with handling. So if your kids are playing with that receipt somehow and then they put their hands to their mouth, well, they just got a dose of BPA. So frequent washing of hands gets that sort of thing off. Other things kids could be touching during the day would include furniture, perhaps, that contains fire retardant, which is a brominated compound that interferes with thyroid function and perhaps other issues in the body. Also, there's flame retardant commonly on children's pajamas. They're going to be touching that and then putting that in their mouth. So I don't recommend washing hands every 10 minutes or anything like that, but wash your hands a few times during the day. Get your kids in that habit. Some people like to use the alcohol-based sanitizing gels for their hands. Those are fine for reducing the bacterial count and perhaps deactivating some viruses that might be on your hand, but they do nothing for soiled hands. So if you've got mucus on your hands from wiping your nose or something, you really need to use soap and water. Don't just rely on an antibacterial alcohol gel. Pesticides in the home, not a good idea. Organophosphate pesticides really have significant effects on the nervous system of the body. I would especially avoid it if you've already got a child at home with neurological symptoms like autism. I would really make a point of avoiding that. And if you spray them out in the yard for some reason, there's a good chance that your kids are going to go out there and play in it and get into it anyway. Or you might have an animal that gets into it and then brings it into the house. So there are a lot of different ways to address pests in the home that don't rely on these things. Old-fashioned things like detergent and water, hot pepper spray, diatomaceous earth. These things are all very safe for us and can usually do the job. Likewise, chemical herbicides around the home I don't recommend using. There are other ways to deal with pesky plants than spraying chemicals on them. Do not cook on Teflon or other nonstick surfaces. In particular, Teflon or Silverstone or any of these types of nonstick surfaces are a problem when heated to high temperature. They tend to vaporize, and their gases are toxic. They can kill birds that are in the home, and they can be irritating to the respiratory tract. So I would try to avoid those as possible. I recommend stainless steel cookware, Corningware, which is a glass-based cookware, or cast iron. The Environmental Working Group website has some really great resources for trying to maintain a healthy home. I highly recommend you check out this link. So for your kids who are siblings of affected children, should you give them vitamins? You know, it's certainly an individual decision, and it should be a case-by-case basis. However, in my experience, most people in this country are not getting enough nutrients from their diet, even if they're eating a very high-quality diet. And partly that's because I think soils are being depleted. We're not getting the mineral content in our vegetables and fruits that we used to. And it may be next to impossible to actually achieve all your nutritional needs from your diet nowadays. So for most people, I would recommend at least a basic high-quality multivitamin. Not all vitamins are made the same. A chewable Flintstones vitamin, I would not use that. In fact, I would probably recommend no vitamin instead of using that, because a lot of these vitamins are filled with things like sugar, artificial colors, artificial sweeteners, things that I think are actually perhaps more toxic than any benefit it might provide. So we have a blog entry, and the website is listed here for you to check out what we mean by high quality supplementation. I've already kind of gone over I think this information here. And you can certainly go buy a multivitamin and start it. You don't need a doctor to do that. But if you do enlist a professional, like a clinical nutritionist, for example, you're going to get better results, because there's lab tests that can be done to identify specific needs. And those needs are not necessarily just based on your diet, but on your particular body's needs. Not everyone needs the same amount of every vitamin. So yeah, you know, if you can do that, I think that's a great thing to do for everyone in your family. Also, we don't want to ignore minerals. Calcium, magnesium are very important. Magnesium tends to be deficient in the American diet. It's very rich in the whole foods diet, but if you're eating a lot of processed things, you're probably not getting enough magnesium. Calcium is fairly abundant in green leafy vegetables and some nuts and seeds, but you know, a lot of people are worried about calcium deficiencies if they go on a dairy-free diet. You know, it is, I guess, a potential issue. I would ideally try to figure out exactly how much calcium you're getting in your diet and supplement if you are low. Also, don't forget these fat-soluble vitamins, A, D, E, and K. Those are not always easily put into a multivitamin. They're better given in a oily liquid, and so sometimes you buy these in a dropper bottle for best administration. And then there's other minerals that are awfully important too, zinc and selenium. These are things that are, they can be supplemented on a kind of ad hoc basis, but again, there are ways to evaluate through lab work whether there's a true deficiency for these things. I want to just give some special attention to vitamin D. There's a epidemic of vitamin D deficiency in this country. We're just not out in the sun, perhaps as much as our ancestors were. Not many of us are farmers anymore. But you know, I've seen patients in the clinic who were professional landscapers out in the sun at least 5 days a week, all day, who did not have adequate vitamin D levels on blood testing. So this is something that ideally should be tested and then supplemented if necessary, but I find most people are deficient. A general rule of thumb for vitamin D supplementation is about 1,000 units for every 25 pounds of body weight, but that does need to be followed up with lab monitoring about every 3 months just to make sure that you're really getting the right amount. It is possible to get too much vitamin D. You really have to get an awful lot for a long time to be toxic, but that shouldn't be completely ignored. I talked about calcium and magnesium. This is a good point here about Tums is really not a great calcium supplement. I know a lot of people use it like that. And there are also other candy-like calcium supplements out there, chocolate flavored and such. If it's calcium carbonate, that's really not going to absorb very well. Calcium needs an acidic environment in the stomach to get absorbed, and taking antacids kind of defeats that purpose. Also, don't forget about fish oil. This is something that really should be supplemented in just about every child unless they're really eating a lot of wild salmon or sardines or anchovies. And I don't know about you, but I don't know any kids eating a lot of those things. There are some brands are better than others when it comes to fish oil. You want one that's been tested for toxic metal contamination, PCBs, and other toxins. I also think that a cod liver oil, which contains a natural form of vitamin A and D, adds an extra bonus for a lot of people's health. You might have heard your parents or grandparents talking about having to take cod liver oil when they were kids. But your ancestors were onto something. These things really did supply a lot of essential vitamins that kids weren't getting in any other way. Unless you're eating a lot of beef liver or something, you're probably not getting a lot of natural vitamin A in your diet. And this is a list of some of the brands that we recommend, and I wholeheartedly recommend any of these brands. This is an often neglected part of our diet, which is natural bacteria or probiotics. You can certainly get these from a pill, but you really I think get better benefits if you get it regularly in your diet. You actually get higher amounts if you are making these things at home and eating them. This is the way our ancestors populated their intestines. Fermented foods was a way to preserve foods before the days of refrigeration. I listed several examples here, but there are others. There's a picture there of several brands of, or several flavors of a kombucha brand. Kombucha is getting very popular in the stores. It's also very easy to make at home. All you need to do is find a friend or someone who has a starter and ask them for a clone of theirs. Every time you make a batch, the starter clones itself, and you can pass that on to a friend. And it's a nice alternative to soda. Also at the bottom there, I have lactic pickles. You can buy some of these in the store. One common brand is called Bubby's, and this is a pickle made with no vinegar. It's actually a fermented product, and the acid in there is lactic acid instead of acetic acid. I think they're really great tasting, and they've got some healthy cultures. And here's a link to a New York Times article that recently came out talking about the fact that there's actually more bacterial cells in our body than there are human cells, and what that implies. It's a good article. So here's some other issues that in the literature are not necessarily identified as specific issues for siblings of kids on the spectrum. But in my clinical experience, these are things that I do see frequently. And they may be related to a family history of autism. They may not be, but these are certainly things that I would look for in any child in today's world. Look for digestive issues, abdominal pain, diarrhea, constipation, growth issues. All these things could point to a food sensitivity or perhaps an inflammatory bowel disease. Joint pains also kind of go along with gut issues and autoimmune issues. They should not be there for any length of time in any child. If a child is getting sick frequently, either with frequent viral infections, frequent bouts of warts, frequent ear infections, there may be something going on with that child's immune system, and I would have a doctor do an immune workup. Also, I mentioned this before, but any kid with frequent ear infections really needs to get off of dairy products. That makes such a big improvement in most of these kids. Same goes for asthma, allergies, and eczema. All those things typically will improve off of dairy products. It may not be the final solution, but it tends to improve things. If a child is having sleep problems, I would not let that slide. Proper sleep is important for proper growth. And, of course, delayed development we talked at length about. So, in summary, siblings are at higher risk of developmental delays, mild and speech issues, autistic speech issues. I think there are ways to prevent these issues, and we're still learning about how to do that best, but we've already seen some doctors report some great success at preventing issues from starting in the first place. Optimizing diet and nutrition, avoiding known environmental toxins can certainly improve general health. Be aware of potential issues that are unique to siblings of kids on the spectrum, emotional issues, and developmental issues especially. And then you want to access healthcare providers, diagnosticians when needed. So thank you very much. I'm going to see if I can answer some questions. Let's see. Okay. Well, I got some good questions here. What about respiratory infections in kids with asthma? What alternative is there to antibiotics? That's a good question. And, one thing I believe as a doctor who's had to treat this issue is that antibiotics are not always given to these kids because it's thought that there's a bacterial infection going on. Sometimes kids come in with an asthma flare-up that's so severe that you just don't want to take any chances. You don't want to miss the low possibility that there could be a bacterial infection triggering it. In reality, bacterial infections rarely trigger asthma flare-ups. That doesn't mean that doctors are wrong when they give antibiotics in that situation. But I think that the key there is to try to do things to minimize the flare-ups to begin with. Because they're typically not caused by infection, at least not bacterial infection. So how can you do that? Well, there's some evidence to suggest that kids with optimum levels of vitamin D and healthy supplementations of fish oil and magnesium, that all of those things can decrease the frequency of asthma flare-ups. Of course, you also want to avoid any known triggers. So if you have a child who's allergic to cats or dogs or anything else that you know to be in a home that you can remove, even if they don't test very strongly for that allergen, I would still get it out of the house. And then, of course, I talked about dairy products. I do think dairy products tend to make asthma worse. And fermented foods and probiotics have a natural modulatory effect on the immune system to tend to decrease allergic reactions and improve natural immunity. So I would definitely look at that as well. So here's a question. What is a good anti-candida diet? Well, there are a few out there, and there's not necessarily the correct one. I know a lot of parents, for example, who have tried both the specific carbohydrate diet and the GAPS diet and found that one worked better than the other, whereas other people say the reverse. If you have a child with a frequent problem with intestinal candida, general guidelines are you want to reduce the food for that yeast. And yeast really likes sugar. So you want to go with a low sugar diet. And then carbohydrates, especially refined starches like white flour, rice flour, things like that, they're going to be converted pretty quickly in the body to glucose. And so most of these diets tend to eliminate grains. And I think that's a reasonable approach. I think beyond that, I can't say anything specifically, though. Here's a question. Does sunscreen block the absorption of vitamin D? Unquestionably, it does. So if you're out in the sun with sunscreen on, don't count on your body making a lot of vitamin D. That doesn't mean that I want people to going out getting sunburned. But I do think that some sun that not enough to burn you, but perhaps enough to give you a bit of a tan is probably a good thing. Your body makes a natural form of vitamin D with that UV light, but UV light also has other functions that I think we're probably still figuring out. For example, it does seem to be involved in cholesterol metabolism, and so we may find out that it's actually a good thing to be out in the sun more often than we were told. And another question here is, can you speak more about glutathione and its role in the body? Are autistic persons more at risk for low glutathione, and why? Well, that's a great question. I don't know that I have a definitive answer for that last part. But in general, glutathione is kind of the body's supreme detoxifying agent and antioxidant. And so a deficiency of glutathione for whatever reason is typically a bad thing, especially if you suddenly, encounter an onslaught of toxins. Are autistic persons more at risk for low glutathione? They are. That's pretty well established. The kids on the spectrum have lower levels of glutathione. It's not easy to measure, by the way. So if you go to your doctor and say, I want my child's glutathione level checked, the only readily available lab to do that is a lab that measures total glutathione. That's measuring oxidized and reduced glutathione. In reality, the oxidized glutathione is not of very much use. And so you could measure a total glutathione and feel comforted that it's in the normal range, but if most of that is an oxidized glutathione, that's really not doing the job. So this is a difficult thing to determine, but in general, most kids on the spectrum in the studies that were done were found to be low. Why that is? There could be many reasons for that. There could be increased amount of oxidative stress in the body that's gobbling up the glutathione. There could be increased exposures to toxins that have yet to be identified. There could be genetic factors as well that are just limiting the production for reasons that we probably haven't determined yet. So I believe that, let's see. Let's see if there's any other questions. I think that is it. So thank you very much, everyone. It's been a real pleasure, and I hope this was valuable for you, and hope to talk to you again sometime soon. Thank you very much.